Violence against women is one of the major problems in Africa, in developing countries. And Uganda is one of those countries where violence against women is very high. Traditionally, it is widely accepted to do violence against women, but this is not okay. We have to change this attitude. So it is important for WHO as well to work with other sectors to increase awareness in the community, also at a different level.
We do have a number of partners now working in this area. UNFPA, UNICEF, UN Women, WHO, UNAIDS. But you also see that the government sectors themselves, the Ministry of Health, the Ministry of Gender, the Ministry of Finance, they come together to institute a sectoral working group that addresses gender-based violence. We work with the police, that is the Ministry of Internal Affairs. We work with the legal fraternity, and these have supported the Ministry of Health, for instance, to develop better the training materials for health workers, but they also help in how health workers can respond when they are expected to within the courts of law when they are called upon.
Working together with our partners, we have made great strides in supporting women against gender-based violence. We have gone ahead to review our Police Form 3 for victims of gender-based violence. This form can now be filled by nurses and clinical officers who have been trained in documenting the right required information that is necessary for litigation purposes. We have also established what we call gender-based violence safety centers in a number of districts. We have them in the northeastern part of the country, in Moroto. We have them in northern Uganda, in Lira and Gulu, and in western Uganda at Mbarara. We also have centers in Masaka. We have also gone ahead to develop a male involvement strategy, which has helped us to engage the men and have dialogue with them on the issues of gender-based violence. We also find ways of empowering them through support from our partners so that they are able to have income-generating activities that can take their minds away from violence and more to economic empowerment. We have managed to strengthen our health centers by providing diagnostic kits so that the health workers are able to diagnose victims of gender-based violence and document the correct records and also keep evidence for litigation purposes.
There is a lot of evidence showing that the prevalence of gender-based violence is actually high. About 6 out of 10 of women aged between 15 to 49 actually have ever suffered in their lifetime an incident of either physical or sexual violence.
We see many cases of domestic violence that range from over 7,000 and 8,000 per year, and that is just a quarter of those who report the cases, according to the research and the surveys that we are doing as police and also the other partners who are doing that kind of work in domestic violence. The change in attitude in provision of services at stations, where we are actually trying to put, at least most stations try to have different desks to handle gender-based violence. These are particular desks that are now handling gender-based violence, which wasn't the case before things started to build up as an issue that has been seen as a drive of many other diseases, many other health conditions, many other physical and emotional conditions that we are seeing in health.
However, one of the biggest challenges that the country has in relation to the health sector response in this area is the infrastructure needs for standard management of the survivors of gender-based violence. In terms of the confidentiality, the privacy, the equipment required, the lab reagents, and the skills. So the health systems blocks, really, which need to be put together to respond appropriately to the survivor, are not readily available. We don't have adequate, of course, government resources per se to bring on board what we need to manage the survivors in its defined standards. But we also know that there are very few projects coming into the country integrating gender-based violence.
There are low staffing levels in the hospitals where we operate, and so this becomes a challenge, especially like in Mulago. Our clinic is situated on an emergency ward, and so you find like maybe one staff is on the ward, and then she has like 3 mothers who need emergency attention, and then a survivor of sexual violence also comes. So you find that the client will have to wait for some time, and of course the staffing is not in our control as a program, and this is not a decision of one person maybe to increase on the staffing levels. The other challenge we face is the late coming or reporting of the survivors. And mainly I think it's because the communities are not sensitized so well, and also the stigma part of it associated to sexual violence. And the fact that also communities condone sexual violence when it happens, people don't know that there are services available, they don't know it's a crime to report, then there are families involved, they don't want to bring conflicts at home within the families. So in most cases, these people either do not report at all or they report late.
Many of these clients actually don't know that police is offering such such services because of the information flow that probably is not going on much into the community to know that we offer the service of emergency care of sexual gender-based survivors, victims. As police, they are more interested in us as investigative officers to handle police form 3s and probably forward them to judiciary, and that's all that people think that we offer in police. But it is more to it. It's more than just the investigation. We also offer the medical services.
Awareness creation is one of the first things that WHO has contributed to. This has therefore enabled the ministry to respond by ensuring that the policy guidance, the health sector development plan, the training materials are also put in place. And the WHO has offered both financial and technical support to the Ministry of Health and partners to put this in the health sector response. The WHO, within the joint program on gender, has worked with the Ministry of Health and the UN in total to make sure that equipment which is specifically improving the diagnosis and the management of GBV survivors is brought in the country.
The World Health Organization is training some of our police officers in various districts where they go, and they are trying to coordinate most of other sectors like the CDOs, community development officers, and other political leaders to try to come together to know how to address sexual gender-based violence as a key element in health vis-a-vis the legal structures that are there.
So work has begun, but a lot more needs to be done, and a lot more resources are being mobilized by both the World Health Organization and other sister UN bodies to make sure that this work is scaled up in the country.